Hello, everybody, and this is one of the last days for Back to Basics. So today I'm just going to go over a little bit of chiropractic schooling. So I was asked a while ago about what are my credentials? Why am I allowed to talk about certain things? Where did I get my knowledge from? And at first, it kind of rubbed me the wrong way because I really wasn't aware of people's perception of chiropractic school. So they think that we just go to school to learn how to adjust. And it honestly is so much more than that. And so I just wanted to explain a little bit about what we learn during school nowadays. Now, I'm not quite sure what Dr. Larry learned back in the day, but I'm pretty familiar with the current curriculum of chiropractic school since I graduated more recently. And so, all in all, our chiropractic school goes for 10 trimesters. So it's 15 weeks of schooling, and then we get a 2-week break. 15 weeks of schooling, 2-week break, 15 weeks of schooling. And the first 4 trimesters are basic sciences. And so we learn pretty much all the basics for our first board exam. So that's going to be biochemistry, basic nutrition, cell physiology, immunobiology, microbiology, histology, the study of cells, embryology, the study of embryos, anatomy. So all of our anatomy classes goes with a human dissection lab. And so you're thinking spinal anatomy, systemic anatomy. So systemic anatomy is the entire system, like what are different parts of your ear, different parts of your heart, different parts of your renal system. And then we have chest, abdomen, pelvis. What are the blood flow through the chest, through the heart, through the abdomen? Can you draw it out? I got really good at drawing the different veins, arteries, nerves throughout this part, as well as the extremities. So if you have one muscle, say it's your biceps, so you have to know the insertion point, the origin point, the innervation, the action, the path that it travels. What happens if, injury occurs to that muscle? What action can you not do? What are different muscles that compensate? Then we have head and neck. So everything from the neck up, we have to know, again, the nerves, the ligaments, the tendons, the muscles, all of that. And then neuroanatomy. So we go in depth into the brain, the different parts of the brain, the different areas, what area makes what neurotransmitters, chemicals, whatever. And then we have physiology. So physiology classes all come with labs as well. So we have cardiovascular, pulmonary, endocrine, reproductive, renal, neurophysiology. And then we have pathology classes. So general pathology is the most basic of pathologies that happen to people. You start out with cell death. What causes that? Can it be reversible? Can it be irreversible? Is it an acute condition? Is it a chronic condition? And all of that, plus a little bit more, I left out the boring classes. All of that is on our Part 1 board exam, which we typically take after our 5th trimester. Then in Tri 5, we're preparing to take our first board exam, but we are now moving into like our more clinical based classes. And so we have all of our diagnosis classes. So physical diagnosis, we're learning how to do a physical exam, palpation, breath sounds, heart exam, vitals, all of that. And then we have head, ears, eyes, nose, and throat. So we call it HEAT. And we learn how to do an ear exam, how to do an eye exam, different cranial nerves and how they affect, if there's something wrong with a cranial nerve, how do you assess that? And then we have neuromuscular skeletal diagnosis, CPE, gastrointestinal, genitourinary, OBGYN. People don't typically know that we have to take a full course on obstetrics and gynecology. We have to, during our lab for that class, we have to learn how to do a breast exam. We have to learn how to do a cervical check, a pap smear. And, I hope I never have to do one of those in my office, which I won't. I never will. But in some states, legally, you have to be able to do those. And then pediatrics. So being able to assess different pediatric disorders, things that come in that, parents are like, oh, it's just an ear infection. Well, is it really just an ear infection? Let's take a closer look. And so then we move on to geriatrics. So a lot of that is going to be like a neurology, nervous system type thing. But then you have, heart conditions and pneumonia, things that pop up more frequent when you get older. And then we have differential diagnosis. So differential diagnosis is looking at a case study and they give you all of these signs and symptoms and say, okay, what is the diagnosis? Well, if you paid attention in your previous classes, it's still sometimes really hard because there's a bunch of different disorders that all look the same and they only have one or two varying factors. So then we also have radiology classes. So our radiology is skeletal, soft tissue, advanced, where we learn how to read an MRI, a CT scan, a PET scan, ultrasounds. So it's not just looking at x-rays for us. And then we have procedures. How do you take an x-ray? And then we have x-ray physics. At the end of our schooling, we have a toxicology pharmacology class where we have to learn drug interactions. And so those are just like the basic classes that we take. And we have to take 5 different board exams. Our board exams include, part 1 after trimester 5, and then we have 2 and 3, which is a little bit more like diagnosis type stuff. We have a PT board exams that we have to take, so physiotherapy, which we take 2 physical or physiotherapy classes. We take a soft tissue class. We take adjusting classes. So when somebody says, well, what are your credentials? Why are you allowed to say these kinds of things? It's because we learn them in school. That's part of being a primary care physician. And so, next time, if you have the question like, who do I go to see this? Shoot us a message, give us a call. We may be able to help you. There's a lot that we are able to diagnose, and there's some things that we aren't able to diagnose. And so just keep us in mind. If you have issues that aren't just, spine related, oh, my neck hurts, oh, my low back hurts. We do a ton of work with functional medicine, nutrition, dieting, exercise, different physiotherapies, physical therapies, exercises, stuff like that. And so we are very well-rounded, and school prepares us for that. So if you have any questions, or, you want to know more about, what our schooling entails, feel free to reach out, leave a message on this video, or send us a private message. Either way, I love talking about it. I enjoyed my schooling. I really loved a lot of my professors. I still go and talk to them a lot because they're just amazing individuals who really care. And so if, you have questions, feel free to reach out. And that is it for my last video for our Back to Basics month. Next month will be something different, so stay tuned for that. Have a good rest of your day. Bye.